An absence of clear guidelines around hydration could be affecting the nation's health. Recent research has shown that many people in the UK are unaware they are mildly dehydrated on a daily basis. More concerning still is the chronic impact this has on vulnerable groups. The evidence comes from members of the European Hydration Institute, which was set up to highlight the effects of hydration on health, wellness and performance.
There's lots of things that you hear in the media about nutrition. Everyone's always telling you what you need to eat. But the area of what you need to drink is often something that's totally forgotten.
Healthy hydration in children is vital for both general health and concentration. Research has revealed that almost 70% of boys and over half of girls aged 9 to 11 years old were not sufficiently hydrated when they arrived at school.
It's very common for children to arrive at school having not had anything to drink at all. We've collected some data at UEL where we found that many children were going to school without having had any breakfast and without having had anything to drink at all. It is likely that these children will not be performing at their best when they're at school, so they may find that they're feeling a bit more tired than normal and their ability to concentrate may be less than if they were well hydrated. Parents should encourage their children to have a drink before they go to school, or to have some milk with their cereal just to make sure that they're having some fluid in the morning.
Dehydration can also have a drastic effect on the elderly.
There was a study carried out just recently at Queen's Medical Centre in Nottingham, for example. They looked at elderly people being acutely admitted to hospital, significant number dehydrated on admission, but we simply don't have the evidence on how many people are not drinking enough.
Proper hydration, both in terms of fluid intake and salt intake, play a major role in cardiovascular health as we age. Young individuals, when they're dehydrated, have the symptoms that most of us would know about with respect to dehydration. The problem with diagnosing those same symptoms of dehydration in the elderly is that those are all symptoms of aging. I think that even some healthcare providers aren't as well educated as they might be about the impact of dehydration in the elderly, the prevalence of dehydration in the institutionalized elderly, and what to look for in terms of signs and symptoms of dehydration.
The lack of knowledge is startling, with 50% of Britons unaware of the recommended daily water intake. Almost 60% wrongly believe that caffeine increases dehydration, and most were unaware of the health implications from dehydration.
You go to your GP for a checkup, they maybe look at your blood pressure, they maybe check your blood sugar level, maybe check how well your liver's functioning. They don't check how well hydrated you are. It's not something that's on the radar for most people.
The EHI says that because of that lack of knowledge, many of us are unaware that we can drink a range of beverages each day, including coffee, tea, light alcoholic drinks, as well as water. We can also maintain our hydration levels from our food.
Some years ago I had issue with an in-flight magazine that said don't drink tea, coffee and cola during the flight because it'll make you dehydrated. Well, the answer is if you don't drink tea, coffee and cola during the flight, most people don't drink something else instead. They don't want water, they don't like fizzy drinks perhaps, they simply do without. That means you end up more dehydrated.
The EHI hopes to raise the profile of the potential impact of poor hydration and ensure nutrition and hydration are given the same consideration.
From a public health point of view, it's a very simple thing that can contribute to our health, just encouraging people to drink enough. And if that has health benefits, then obviously that can have savings for the public health purse, but also make people feel slightly better and have a better quality of life.